Thank you, Simon.
Okay, thank you, Simon. I think you could answer that question because you have been following our press regularly, and we comment on any country about health situation or health conditions, be it Syria or now Ukraine, Yemen, and other places. For instance, if I bring similar conditions like Tigray, if you take Syria, there are people who didn't have access to humanitarian aid, and WHO, as part of the other UN agencies, and myself as one of the heads of the agencies, we have been pushing for unfettered access. Not only unfettered access, we have been even pushing for a corridor to keep a corridor to Syria from Turkey. On Ethiopia's issue, when we push for unfettered access, the responsibility is given to the Ethiopian government. But in Syria's case, the UN Security Council had decided to have a corridor through Turkey, and the UN has been supportive of this. So we always advocate for unfettered access and, access to medicines, access to food, and people to get the necessary support they need. And we have been doing the same thing in all conditions where there is the same problem. For instance, if you take the Syrian issue, it's resolved because there is another corridor. Even if the Syrian government doesn't want to let access, doesn't want to give access, there is another corridor through which those who need access get access. So I don't know why this is seen as a special, the Tigray one, but it's exactly the same. And I will repeat again, there should be unfettered access to support the more than 6 million people of Tigray. What makes it even very unique, the Tigray situation, is it's completely sealed off by both Ethiopian and Eritrean governments. So not only access to food is limited, it's trickling now, and access to medicine is very limited. Our programs, HIV program, TB program has collapsed, and people on chronic follow-up, hypertension, diabetes, they don't get medicine, so that has also collapsed. And many people that could be saved are dying because there are the more than 6 million people are completely sealed. What they get is a trickle. But not only that, not only the food and medicine, they can't have even access to their own money because banking service has been blocked for more than almost 2 years now. I told you last time, imagine if you were prevented by your own government from accessing your own money, Simon. Not just 6 million people, even one individual would be, I don't think would survive. You would survive. And then not only banking services, there is no telecom services. That's also blocked by the government, and electricity and other basic services. I will tell you my own story. I have many relatives there. I want to send them money. I cannot send them money. They're starving, I know. I cannot help them. I cannot help them. I can help them. I can share from what I have. I cannot do that because they are completely sealed off. I want to speak to them. It's a long time since I have spoken to them. I can't speak to them. I don't know even who is dead or who is alive. Can you tell me any place in the same situation in the world? Simon, can you tell me? So I'm talking about the 6 million people which are collectively being punished. And I can tell you, the world can do this. It has the means. For instance, the world came together 2 weeks ago and did a very good job in helping Ukraine to export its grains. Okay, that's a good job. But why can't we also push as a global community so that the 6 million people can get food to eat, medicines to be treated, and telecom to talk to their people, bank to access their money, and media so that they can speak and the world can know about their problems. Why can't we do that? Why can't we push for unfettered access? So unfettered access, asking for unfettered access for the opening of basic services, and for also asking the Ethiopian government and the Eritrean government who are enforcing the siege systematically to end the siege is part of my job. I did it for Yemen. I have traveled there. I did it for Syria. I'm doing it for Ukraine. You remember my statement several times. All the reports we have been saying since the invasion of Ukraine by Russia. And we asked Russia to end the war many times. And we're also helping. What's different about Ethiopia? We're not actually doing as much as what we did in Syria. Maybe it's time to ask for another corridor to help the 6 million people, like what is being done in Syria. We can even push for that, of course, because this is about humanity, nothing else. I have no interest. That's my interest. And I will do it anywhere. I will do it for Yemen, I will do it for Ukraine, I will do it for Syria, I will do it for other countries. And I think, Simon, you know better, you have been following us, you can say it yourself and others are also following. That's it. It's about humanity. I'm one of them. I am one of the 6 million people. That's personally hurtful, very painful. But at the same time, I'm doing it because 6 million people are human beings. Because I'm one of them, conflict of interest, whatever, what I should do, I should do. Like I do for others. I even did more for others. I think that's very, very clear. Last week, I spoke about the drought and famine in the Greater Horn of Africa, where WHO has launched an appeal for $124 million to prevent and control outbreaks, to treat malnutrition, and to provide essential health services and medicines. So far, we have received just 12% of the funds we need. In the Ethiopian region of Tigray, fighting resumed yesterday. It's tragic to see the resumption of active conflict. But in reality, the war had never stopped. For more than 21 months, the 6 million people of Tigray have been under a suffocating siege that has killed people not only with bullets or bombs, but by weaponizing banking, fuel, food, electricity, and healthcare. That's why we have been calling for the resumption of essential services and an end to the blockade systematically enforced by the governments of Ethiopia and Eritrea. The only solution is peace, and we continue to call for a peaceful resolution. The emergencies in Tigray and the Greater Horn are far from the only crisis in Africa. The Sahel region is facing one of the largest, fastest growing, and longest lasting crises in the world. Across Burkina Faso, far north Cameroon, Chad, Mali, Niger, and northeast Nigeria, more than 33 million people are in need, and there are 6.7 million displaced people due to conflict, the worst drought in 40 years, and disease outbreaks. Last year, more than 3,600 people in the Sahel died with cholera, and transmission of yellow fever is at the highest in 20 years. Disrupted immunization campaigns due to COVID-19 have led to increasing transmission of measles and vaccine-derived polio. WHO has released $8.3 million from the contingency fund for emergencies to cover life-saving services in the Sahel. But that's a fraction of the almost $63 million we need this year. We continue to urge donors not to forget the Sahel. Finally, earlier this week, health authorities in the Democratic Republic of the Congo confirmed a case of Ebola in the northeastern town of Beni, which was the epicenter of the 2018 to 2020 Ebola outbreak. So far, 179 contacts have been identified. Vaccination of contacts and contacts of contacts began today. Since the last major outbreak ended in 2020, there have been occasional flare-ups which have been brought under control immediately. WHO will continue to support health authorities in DRC and the province of North Kivu to respond to this case and to prevent further transmission. Last week, WHO published new guidelines recommending the use of 2 therapeutics against Ebola, which have demonstrated clear benefits in reducing deaths by about 60%. DRC has supplies of these medicines should they be needed. With highly effective vaccines and therapeutics, Ebola is now a preventable and treatable disease. That's very clear. Then on my friend Tony Fauci, we have been friends for many years. I respect him dearly and greatly. He's an incredible scientist, amazing human being. And, congratulations to him for, all the job that he has done. I know retirement doesn't mean he will stop working. Retiring for him is like changing a tire, meaning another mission. And I look forward to continue working with him closely, through other things he will, I know, continue to do. So I wish him all the very best. Tony is so special, and everybody knows, I think. Thank you.